Good evening. Hi, everybody. Welcome to today's chat. My name is Bang Bui, and there's my email if you ever have any questions. I'm based at the University of Melbourne, and I'm an optometrist, and I've been doing research in glaucoma for the past few years, more than I can count now, I think. But the team have asked me to have a chat to you today about the impact of glaucoma and vision loss on daily living tasks and what it does to mental health. So I'll do my best to try and summarize some of the latest literature in the area. And of course, if you have any questions, just pop them in the chat and then do let us know. And if you're comfortable, you can always email me afterwards. And if there's something that I haven't told you or it's not clear, we can try and clarify it later on. So glaucoma itself, as you know, causes vision loss, and some of that really affects the activities that we do day to day. And literature would suggest that the things that are most important to those living with glaucoma is being able to see fine detail, being able to get around about the house, having trouble with darkness or glare, concerns about bumping into or seeing objects, and then household chores. So those are kind of the top 5 things that people kind of, highlight as issues when they encounter vision loss. But of course, much broader than that, there's lots of array of daily living tasks that become impacted when you start to lose your vision. And so, as we've mentioned, reading is a really important one, but walking and walking on stairs, driving is a big concern, and balance, adjusting to different lighting conditions. So during the day, things might feel different to at night, where there's a lot more glare light sources. Seeing at night is a real challenge. And so, this leads to difficulty with very bright extremes of lighting, very bright and very dim conditions. And so all of these things that we take for granted means that it leads to an impact on the quality of life. And so what we're starting to learn from the literature is that quality of life for people who have any vision loss at all, even with a diagnosis of glaucoma, quality of life can be impacted really early on, and it progresses. And not surprisingly, because we've got 2 eyes, and one eye kind of fills in the gaps for the other eye, and the brain melds it all together to make us see the world in stereo. So sometimes when both eyes get affected, quality of life drops even more. Okay, so it's really not, the obvious things are really advanced vision loss in glaucoma increases the risk of falls and car crashes, but that's the really severe end of the spectrum. We're talking about changing quality of life really early on. So we're going to talk about some of those things now, and it's not a comprehensive list of everything that's been impacted, but I thought I'd pick out some bits of literature that you might find interesting. So so quality of life, it's usually done in a survey, and people are asked to rate how they think things are going, and a series of questionnaires that are well validated. And so glaucoma, as you know, this end of the spectrum here, where you've got good visual fields, and then as you progress into this direction, where the visual field starts to decline, so that sometimes the way that the condition is portrayed is that you're left with this central island of vision, and it's really severe peripheral vision loss. But really early on, at this end of the spectrum, there is a linear relationship, so that even at this end, quality of life can be rated quite low by some people, even though the vision is quite good. And so we're trying to understand why quality of life ratings might be much lower in some individual, and starting to think about and really much more thinking about holistically about how the whole range of things a person does with their eyes and their environment and their social interactions might be impacted by vision loss. So the other thing that's a point to make here is that the earlier we can detect and manage glaucoma, the better quality of life will be, because hopefully if your vision loss is up here, then your quality of life is around about this normal range. The other thing that we know is that if there's more vision loss, quality of life is rated lower. And so on this axis here, what this is telling us is that this is the change, the rate of change. So if you're 0, that means your vision is stable. So up at this end means that there's no progression of vision loss. That hopefully that means that the management approaches that we've put in place and with you is working well. But if you're down in this direction and you've got a negative number, that means that your vision loss is progressing according to visual field measurements. And so what this tells us is that if someone's having progressive vision loss, then they will rate their quality of life as much lower. And so that's obvious to kind of think about. But if we can kind of slow that down at all using a treatment, or if we know that this is happening and we know that it's impacting a person's quality of life, then we start to think about changing the management strategy so that we can slow this slope down, so that getting people back to 0 means that they won't the way that they rate their quality of life won't be lower. So it's an interesting insight into the amount of vision loss, but how quickly you lose it affects the way that you're feeling about the process. So of course, just having poor vision itself increases fear of going blind, which can lead to social withdrawal. And so poorer quality of life, we understand now, is associated with having other conditions as well. And that includes other ocular conditions or medical conditions. And perhaps the most common ocular condition that you might encounter is also having cataracts or risk of age-related macular degeneration and other conditions like that. And so having multiple conditions means that you're more likely to have a quality of life. In addition to that, there are psychological, there's the environment around you, there are socioeconomic factors that determine how well you can access healthcare. All of these things can further reduce quality of life. And so depression is more common in glaucoma, and we know that, and is associated with reduced quality of life. So the ultimate impact of reduced quality of life is the risk of depression. And so finally, medications that we use in glaucoma can also have adverse effects. And so this list here is telling us that what we need to do is to manage all these factors holistically, right? Because so yes, we've got a question that says that is quality of life impacted early or only with moderate glaucoma? Quality of life gets impacted, I think, from the moment that you are told that you're at risk of glaucoma, even, and then when you're told that you have glaucoma, the diagnosis itself is a challenge to a lot of people. And so we need to start thinking about quality of life from the very beginning, and that process we need to start to think about as a community, as caregivers, as practitioners, about how our awareness that even the diagnosis itself, even before there's any substantive vision loss, can impact quality of life. And so then we start to think, well, how can we manage all of these other factors? How can we put in place structures of support to deal with the cataracts, to deal with other health conditions such as systemic hypertension or diabetes and a whole bunch of other things that a person might have. So in essence, thinking about the person holistically. So some more insight into what someone with vision loss might go through. And here are some studies showing us that the cells that die are called the retinal ganglion cells. And some of these actually directly detect light and send that information to the brain. And so those centers of the brain don't see things that aren't visual. They're non-visual centers, but they can regulate sleep. Okay, and so the graph over here says that if you have stable disease, so you've got your vision loss isn't progressing, the amount of sleep you get per night is about an hour more than in those that have progressive disease. And so the data tells us that folks who have vision loss tend to go to sleep about an hour later and get about an hour less sleep. So just understanding the fact that vision loss can impact someone's sleep and their sleep quality. And so we understand how important that is to how rested you feel and how well you feel in general. So sleep quality is impacted by vision loss. So glaucoma impacts reading ability. And so what we find is folks with glaucoma tell us that they read books, puzzles, newspapers, mail and magazines um, less often. Okay, so these are some activities that people tend to do less often. And so what that means is that perhaps for a lot of people, they need help with a lot of these things. They need help looking at that their bills and things like that. And in actual fact, you know, there are many of these activities that they would love to do, but they can't do anymore in a sustained fashion. And that changes the way that we start to kind of, you know, the way that they live. And so it's important to think about how we can help with getting them more able to do these activities of reading that they used to enjoy. So just a point about reading, the way that we read is to kind of jump about, you know, 4 or 5 or 6 letters at a time. And so, you know, what it looks like is that the bit in the middle, the very center of our vision is the clearest, and on the sides, it kind of drops away. And so the extent of this is called the visual span, right? And so the wider your visual span, the more letters that your brain takes in at the same time. So effectively, the wider that is and the brighter, the clearer it is, the faster that you can jump between words. And so that's the way that we kind of read. We kind of read through things like this. And so here's some literature that says, here's the visual span in someone with normal vision. Here's the visual span in someone in a group of people with glaucoma. Right. And this says that the visual span, in terms of the number of letters, 6 letters to this side and 6 letters to this side, that visual span is much narrower. That means someone with glaucoma, with moderate visual loss, means that they're effectively jumping fewer letters at a time. So they're reading slower, right? And so then they don't read for as long, okay? But, you know, there are ways to improve this. You know, changing lighting, improving lighting, print size, optimizing glasses. A lot can be done here, but we often don't refer early and moderate glaucoma to rehabilitative services. We kind of leave these rehabilitative services until there's severe glaucoma. And so in actual fact, helping people really early on learn the techniques to kind of cope with these things, these compensatory things, is actually really, really useful, because they might use those tools later on. To basically, you know, trying to give them as much help as possible to keep them doing the task that they love to do. So of course, there's lots of driving concerns, and driving is often highlighted because it's fundamental to maintaining independence. And so people with glaucoma and vision loss tend to drive and stop driving earlier. And when they stop driving, that's actually associated with a higher risk of depressive symptoms, social isolation, and entry into longer term care. And so there's a host of visual field and vision loss issues that like changes to dark adaptation. You're less able to detect contrast. Maybe depth isn't quite as good, and so people adapt really well. And so they kind of avoid driving situations at night, in the fog, in the rain, during rush hour, on the highway, and in high traffic. They kind of avoid those things. And so in actual fact, the idea that people will come have more car accidents, it's not entirely true, because they've adapted really well to their own situation. Okay, so really, increased car accidents with glaucoma is associated with when both eyes are affected. Okay, so that's a really only case, because early on, driving people with a little bit of vision loss, they cope really, really well, and so they sometimes compensate. They compensate by making more head movements, and they move their eyes a bit more. They kind of scan their visual field more efficiently to look for gaps in things. And so people can develop really good strategies for coping with a small amount of vision loss. And it's only when the vision loss becomes binocular that there might be issues. Yeah, so if you've got vision loss in both eyes, you're more likely to have a problem. And so people that compensate and learn how to compensate for driving are really safe drivers. But if you're concerned, an eye care practitioner can assess your binocular vision, how both eyes function together. And falls risk is a big issue, right? Because you know, vision is really important because it helps with your balance and how you navigate the environment. Okay, and so some people will can have more trouble with balance and walking. And again, same point. people with binocular vision loss have much more problems bumping into things. So overall, there's maybe about a 2 or 4-fold increased risk of having some falls. Yeah. Okay. Even here's the challenge. Even if you're not at greater risk of falls, but you've got vision loss, you're more fearful of falling. And because of that fear, you tend to have reduced mobility, right? And so, so here's a study that uses these goggles and basically kind of throws the balance system out of whack, and it asks the question, how does someone who has vision loss with glaucoma compare to someone who doesn't? And it turns out that people who have some vision loss, glaucoma, they tend to not correct their balance as quickly as someone who doesn't have any vision loss. And so it's important to recognize that there is a functional issue, that vision feeds into our vestibular system. And so some people who have some vision loss may not have the same corrective balance control. And so that means that they feel like they feel more like they're more fearful of falling. And so this is a challenge. But you know, to recognize that is we're starting to understand how we might then, you know, use systems like this that help people navigate that. Okay, so depth perception is something that we take for granted, you know, like so when we use our hands, when we write, when we pick things up that are really fine, and imagine you're doing needlework or embroidery, those require, you know, really good depth perception, right? And so here's an important thing that we're starting to recognize now, that in fact, even in those that appear to have really pretty normal visual fields, stereopsis can already be impaired. And so here's a group of controls. Good stereopsis is at this end and bad stereopsis up here. You can see most of the controls are up here, but you get some people who are glaucoma suspect and some people with glaucomatous visual field loss who have poor stereopsis. And so here's again the recognition that even when visual fields look normal, their daily tasks, they're affected. You know, some of these people aren't doing the things they love anymore because, you know, some of these little visual skills that they used to have that we take for granted aren't quite the same. So this is to recognize that when you have impaired depth perception, you tend to walk differently, right? So imagine that you used to enjoy outdoor walking, right? And so if you have normal vision, you tend to look in front of you at about, you tend to look kind of, you know, much further in front of you. When you have poor depth perception, poor vision, you tend to look down at your feet more because you're more worried about falling. You're more worried about the rough surface, right? And so the question is whether depth perception gets tested when you do your driving test, and the answer is no. The answer is no. So yeah, that's okay. So yeah, so you know, if you have poor vision or you have poor depth perception, you tend to look down more, and that means you walk much slower. And so then you're going to avoid things like this. You're going to avoid slightly rough terrain, right? So there's kind of understanding that helps us think about, well, where we kind of place people who have some vision loss or some depth perception issues, the kind of terrain that they would be comfortable walking in, the kind of environments that they would be safe in. And so, yeah, hopefully that provides some useful and interesting insights. And then finally, if you take kind of all of this together, it kind of makes sense that the incidence of depression and anxiety might be a little bit higher in those who have glaucoma. And so certainly with severe glaucoma, you know, there's the depression is a little bit more common. Yeah. And there might be a slightly higher risk of depression and anxiety in females with poor vision and visual fields compared to males. So I guess perhaps all of that I've spoken about up to now provides some insight and you know, be on the lookout for signs of depression and anxiety. And so what we can do is to help people identify additional support when they need it. And so, yeah, so I've just highlighted some of the things that we're starting to learn. That glaucoma is even really early on when there's only a little bit of vision loss. There are daily tasks that we take for granted that probably are impacted, and so people might say, "Hey, that's I've thought that, but no one's ever quantified that before." And what this means is, yeah, So the question is, Charles-Bonnet syndrome common with glaucoma? I don't think anyone's really identified a strong link between Charles-Bonnet syndrome and glaucoma per se. So it's really important that we look out for signs of depression and anxiety. And so, as I said earlier, even from the diagnosis of glaucoma itself and the challenges of having any condition that has the potential for progression is a source of anxiety. And so, we need to be empathetic from the very beginning. And so that empathy comes through the form of better, not just education for the patient, but also the carers and the family around them. And so there's counselling and services and support network and all of the things that we can do to kind of control all of the factors, all of the risk factors, to try and provide support so that you do all the same tasks that you used to do, so that you can maintain independence, and all of that is going to improve quality of life. And so in amongst all of this is health literacy. And the fact that I guess you're here learning about these things means that you're trying to educate yourself in these things. And so health literacy means that this leads to improve the adherence and persistence with monitoring and treatment. And monitoring and treatment is kind of the core thing to make sure that vision loss doesn't progress. And so that, as I introduced much earlier on, means that the likelihood of having better quality of life is improved if you can stop progression. So yes, I think that's the end of what I had to formally say, but I'm happy to take any other questions that you might have. And I realized I was talking at 100 miles an hour there. So if you do have any questions, do email, and then we can try our best to answer them from there. But thank you so much for tuning in, and it was lovely speaking with you all.